Sugar. Are you here to get your teethies clean? You're a sweet girl. We always like to check them out and do a physical exam before we put them under anesthesia. We're also going to draw some blood from her and do a pre-anesthetic panel to make sure liver and kidneys and blood counts are good for her anesthesia. So that's what we're going to do next. Is that okay with you? Okay.
Okay, so we've gotten the blood from Sugar, and we like to run lab work, especially on our geriatric patients, to check their liver and kidneys to make sure that they're functioning normally, since the anesthesia is processed through the liver and kidneys. So I will put this in and run it in just a few minutes. We'll have the results back and get started on the demo.
Okay, we've got Sugar's lab work back and it looks great, so we shouldn't have any issues with her anesthesia today. So now that we've done her physical exam and we've gotten her blood work back, we're in the surgery room, which is where our dental instruments are, and we're going to sedate her and clean her teeth. Sleepy time. Sleepy time. That sedative relaxes them, and we're going to put a tracheal tube in where she can breathe gas anesthesia while she's having her procedure done. After we get everything hooked up, we will hook up her monitor, which is going to tell us her heart rate and her oxygen saturation while she's under anesthesia. So we're going to break for just a minute and get that all hooked up. Okay, Sugar's doing great. She's about halfway through her dental now. Haven't found any loose teeth yet, but we check as we go along to see if we have any loose teeth, and we will extract them if they are very loose, or if we see that there's any deterioration of the root. Another thing too, we also put lubrication in their eyes, because when dogs are under anesthesia, they don't close their eyes. So we want to make sure their eyes don't dry out. And she's also on a water blanket, which keeps her warm during the procedure, so her body temperature doesn't drop. But so far she's doing great, and we're going to flip her over in a minute and do the other side of her mouth, and it won't be long before we'll be finished.
So I finished scaling her teeth, got the outsides and the insides on all of her teeth. And so now the next step is, and I've also checked all of her gum measurements and everything, and she doesn't have any pockets that need to be addressed, so that's good. Her heart rate is excellent, pulse ox is excellent. Next up is to polish the teeth, and I want to do the inside and the outside to make sure that I smooth out any indentions that may have been caused by scaling them. So that is next up. Get my pedal.
Okay, Sugar's all finished with her procedure. You can see she's a little drunk, got a little tongue out a little bit, but she's waking up just fine. And her teeth are nice and clean. She's going to have wonderful fresh breath, and she did great. And if your dog needs their teeth cleaned, just give us a call. We're having a special October dental month where it's just a little bit less expensive for you.